Good morning, doctor.
Hello, Susie. Did you meet outpatient today, Mr. Jones? He's quite the character.
Yeah, when I went to introduce myself, it looked like he was having a conversation with someone, but no one else was around. I asked him who he was talking to and he told me he was talking to his friend Marlene.
You should have been here earlier when he was saying he was Jesus Christ and speaking in a way that no one could understand.
So why is he here?
He came to get electroconvulsive therapy in hopes that it will help him?
You mean electroshock therapy?
Well, yes, even though we don't call it that anymore. Mr. Jones is a subtype of schizophrenia called Schizophrenic or disorganized schizophrenia.
I've heard of paranoid schizophrenia where a person has hallucinations and delusions, but you said Schizophrenic?
Yes, it's similar to paranoid schizophrenia. However, paranoid schizophrenics are usually more stable over time and have a better prognosis. They also don't typically show the same disorganized behaviors you've seen from Mr. Jones.
What symptoms would you typically see in a schizophrenic patient with a disorganized type, doctor?
Well, disorganized schizophrenia usually manifests as a mixture of hallucinations, delusions, disorganized behavior and speech, as well as having the 5 As.
What are the 5 As?
Good questions. They are alogia, affective blunting, anhedonia, avolition, and attentional impairment.
Does a patient have to have all those things to be diagnosed with this?
No, the criteria states that a patient must have 2 characteristic symptoms such as delusions, hallucinations, disorganized speech, catatonic behavior, or negative symptoms. They also must be showing signs of difficulty functioning in work or social environments.
Anything else?
They must have been experiencing these things for at least 6 months. And lastly, other disorders must be ruled out, such as schizoaffective or mood disorders and substance abuse or other general medical conditions.
Are there other types of schizophrenia?
While paranoid and disorganized schizophrenia are probably the most common, other types are catatonic, residual, and undifferentiated types.
Cool. But doctor, why are we performing electroconvulsive therapy on this patient? I thought they only did that back in the old days. Isn't this really cruel?
Electroconvulsive therapy is used as modern medicine for a few behavioral conditions. It's used when other treatment plans have failed or haven't produced sufficient results.
What other treatment options are available for schizophrenia?
Well, most schizophrenic patients will be treated with second-generation antipsychotics, also known as atypical antipsychotics, as well as other mood stabilizers, antidepressants, and anxiolytics. These patients should also have some sort of psychosocial intervention like cognitive behavioral therapy.
Would it be appropriate to treat with first-generation antipsychotics?
First-generation antipsychotics, also known as typical antipsychotics, are used as a second-line therapy. Typical antipsychotics only block dopamine D2 receptors and also cause more extrapyramidal symptoms. With the atypicals, they will block dopamine D2, D3, D4, and serotonin receptors. Plus, they have a lot less extrapyramidal symptom side effects. However, they do have more metabolic side effects.
Wow. I imagine that's just about everything a physician assistant would need to know about schizophrenia for their PANTS exam. What do you say about getting started now?
Let's do it. Hold on to your hat though, because it's gonna be electric.